Welcome to this edition of the LucidQuest Public Health Strategic Roundup, covering developments in prevention, early detection, and risk stratification from June 11th to July 15th, 2026. The defining story of this reporting period is the acceleration of prevention from a population health ambition into a measurable clinical strategy. Across oncology, cardiovascular disease, diabetes, neurodegeneration, and infectious disease, advances in biomarkers, artificial intelligence, vaccines, and early intervention therapies are reshaping how healthcare systems identify and manage risk. This reporting period highlighted a market moving toward earlier action, where detecting biological changes before symptoms emerge could create new opportunities for disease prevention and interception. Several developments pointed to this shift, with 4 themes standing out. The first theme was the expansion of AI and biomarker-driven risk prediction. New research in cardiovascular disease demonstrated how artificial intelligence could identify individuals at elevated risk of sudden cardiac death by analyzing patterns within existing ECG data that conventional approaches may miss. Similar trends are emerging in oncology, where biological aging measures and advanced biomarkers could eventually support earlier identification of cancer risk. These developments suggest a growing market opportunity for predictive diagnostics and precision prevention tools. However, their impact will depend on prospective validation, physician adoption, reimbursement, and evidence that improved prediction leads to better outcomes. A second major theme was the movement of cancer prevention and detection toward earlier biological intervention. Long-term HPV vaccination data reinforced the potential of prevention programs to reduce cancer mortality, while minimally invasive molecular testing approaches highlighted opportunities to make early detection more scalable. Together, these developments indicate that future cancer strategies may combine prevention and surveillance, rather than relying primarily on treatment after diagnosis. The key uncertainty remains whether healthcare systems can achieve the coverage, adoption, and infrastructure required to translate these tools into population-level impact. The third theme was the emergence of pre-symptomatic therapies as a new market category. The introduction of teplizumab for delaying type 1 diabetes progression illustrates a shift toward treating biological risk before conventional disease develops. At the same time, Alzheimer's research in Down syndrome is demonstrating the importance of identifying high-risk populations for earlier clinical intervention. These approaches could expand therapeutic markets, but success will depend on effective screening pathways, biomarker integration, and proof of meaningful clinical benefit. The final theme involved the infrastructure required to make prevention scalable. Across all areas, identifying risk is only valuable if healthcare systems can respond. AI-generated risk signals, biomarker testing, vaccination programs, and disease interception therapies all require coordinated workflows, reimbursement models, and patient engagement strategies. This suggests that future competition may increasingly center on prevention ecosystems rather than individual products. The uncertainty is whether stakeholders can build the delivery systems needed to support this new model of care. Looking ahead, we will be watching validation of biological aging and risk prediction tools, real-world implementation of AI-enabled diagnostics, expansion of biomarker-driven screening strategies, vaccine program performance, and the development of new disease interception therapies linked to earlier diagnosis. The key takeaway is that prevention is becoming a technology-enabled clinical market. The organizations that successfully connect prediction, prevention, and treatment into scalable healthcare pathways may be best positioned as this market evolves. Thank you for joining this edition of the LucidQuest Public Health Strategic Roundup. For more healthcare market intelligence and strategic analysis, visit www.lqventures.com.